Here we go again. The US government just told state governments that they have to pause food stamp benefits in November. This means that potentially millions of Americans will not get food support for the month. Why is this happening? Well, the Republican government shutdown is why. I'll explain at the end of the video why the shutdown's happening and why the Republicans should be blamed for this. But first, let's just talk about how many millions of Americans this will hurt and how. First thing I want to say is I'm a social worker. I've said this in previous videos, but I got my degree in the field. I work full-time as a social worker. I help individuals and families who are marginalized, who are low income. I help them get resources like food, housing, transportation resources, and stuff like that. And some of my clients, oftentimes, after paying all of their bills, they don't have enough money for food, even working full-time. So my job is I connect them to food pantries. I help them apply for SNAP benefits, which is food stamps. The reality is, in America, people can work full-time and still not afford food. This is because capitalism has been weaponized by billionaires and corporations, which has caused the cost of living to skyrocket. Here's the press release from MDHHS. So essentially, the US government instructed the Michigan Department of Health and Human Services to pause issuance of November SNAP benefits. The federal government just made the state government here in Michigan pause all payments of food stamps to Michiganders. And this is happening in other states as well for the entire month of November because of the government shutdown. This is really important here. The Michigan Department of Health and Human Services put out a press release. Here is what it says. MDHHS received communication from the federal government indicating that due to the ongoing federal government funding lapse, there may be limited availability of funds to pay full November Supplemental Nutrition Assistance Program benefits, SNAP, for approximately 42 million Americans across the nation. The state government in Michigan said this: the federal government's delay of SNAP benefits will place Michiganders at risk of food insecurity and poverty. I could have told you that. My clients are living paycheck to paycheck. My clients often have battles with applying for Medicaid, applying for food stamps, and sometimes food stamps get cut off without ample notice. When that happens, if you're getting $100, $200, $300 a month for food stamps, you might not be able to afford to feed your family, at least for that first month or two before you get other things figured out. The release also said, SNAP is a critical program for families and individuals across Michigan to access food. It's the nation's largest food assistance program and one of the most effective tools to reduce food insecurity. 13% of Michigan households, which is 1.4 million people, receive food stamps. 43% are families with children. 36% are families with members who are older adults or disabled. The director of the Michigan Department of Health and Human Services said, SNAP is more than a food assistance program. It's a lifeline for many Michigan families. We are strongly disappointed by the USDA's decision to delay this assistance. And it goes on to explain how SNAP works. SNAP helps lift families out of poverty by allowing them to spend money that would otherwise have been used for food on other goods and services, including health-related activities. A study found that infants and children in SNAP families are more likely to see a doctor for periodic checkups, and older adults who get food stamps are more likely to take full dosage of prescription meds because they have enough income to afford food and medicine. According to an economic analysis, SNAP funding supports approximately 388,000 jobs, more than $20 billion in direct wages, resulting in $4.5 billion in state and federal tax revenue. In other words, the money that we use to give people in food stamps, it pays for itself. When people are fed, when people have food, they are more productive members of society. They are better people when they are fed. They work better. They create more money for the economy. So food stamps pays for itself because healthy, well-fed people give back to the community. It's pretty basic. Just in Michigan alone, there are 492,225 children who get food stamps. 38,513 veterans. And like I said a few minutes ago, 36% of households have older adults, 43% of households have children, over half, 51%, have a person with a disability. It's just like, this is so essential for so many Michiganders and so many Americans nationwide. I'll say this from a social worker perspective. it's not easy to be eligible for food stamps. People who often are conservatives online, they like to say that people are just getting food stamps left and right. They are welfare queens, to some degree. And I'm here to tell you, that's just not true at all. Many of my clients are forced to work in order to get food stamps. People like to complain that we have too much government spending on wasteful things. This is not one of those things. The number one thing that people need to survive is food and water. I'll lump those two things together. Food, water is things that we need to consume. That's the number one thing we need. Do you think that giving low income, disabled, older, perhaps veteran individuals some money for food is a waste of money? If you say yes to that, go fuck yourself. And after you fuck yourself, re-educate yourself, okay? Because providing food, a basic necessity, something that sustains life, like I said earlier, it pays itself back into our economy. It's not just an investment economically, but healthy people. Isn't that something that we want as a society? Healthy, not hungry people. The cost of living is so unbearable today that providing food is the bare minimum that the government should be doing to help everyday people get through these horrible times that we're living in. So I gave you some of the numbers from Michigan and how many families, how many veterans, how many disabled people and low income families are going to be devastated by this month-long pause of food stamps. Here is who we need to blame. The Republican Party controls the Senate, the House, the White House, and by extension, the USDA, every federal agency. They are leading our government right now. Do you understand that the two longest government shutdowns in American history, happened under Donald Trump's leadership? So here's what's really happening in Congress. The House passed a budget bill and the Senate has failed to pass it like 10 times in a row now. So this budget is being held up in the Senate. Democrats are refusing to let this damaging bill pass because guess what's in it? Extreme funding cuts for healthcare. This might be the most noble and truly surprising thing that the Democratic Party has done over the past several years. They've been feckless, they've been weak, especially when Biden was president. They were especially weak under him, even with majorities in Congress. The simple fact is, there's not enough votes in the Senate to pass this bill. And here's one of the main reasons why Democrats are not voting on this bill. In previous federal budgets, there were tax credits for Americans for ACA Marketplace, so the Government Healthcare Marketplace program, which made health insurance premiums lower for many people. Now, I'll admit the Affordable Care Act, which is Obamacare, it has made premiums extremely expensive. That's why the government passed these tax credits for Americans so that it'll lower the premiums. This bill that the Republicans are trying to pass in Congress right now does not renew those tax credits at all. So the millions of Americans who are on the government marketplace healthcare program would face extremely higher premiums for their healthcare immediately without a backup plan. I'm talking hundreds of more dollars per month per person. That's extreme. That would cause an economic disaster. Most Americans are living paycheck to paycheck. Over 60% are. Most cannot afford that. They would have to choose between dropping their healthcare coverage, which could mean extreme disaster personally for them, or go into debt, go into extreme poverty, just so they can have health insurance. It's a lose-lose. So Democrats, thankfully, are not voting on this bill unless those provisions are put in there. Check this out. The Congressional Budget Office estimates that if those tax credits that I mentioned are not extended, which in this current iteration of this budget, it's not, 4.2 million Americans would become uninsured by 2032. 7.3 million less people would receive the subsidized marketplace coverage. So 7.3 million Americans would face extreme high price hikes in their healthcare coverage. This Republican Congress also passed in the Big Beautiful Bill a tons of billions of dollars in cuts to Medicaid nationwide. And they celebrated this because they claimed that those cuts would go to making sure that illegal immigrants are not using Medicaid. Medicaid is for seniors, disabled people, poor families. And no, undocumented immigrants do not receive health care, do not receive Medicaid from the federal government. That's federal law. They can't. It's illegal. Online conservatives need to stop spreading that bullshit misinformation. Now, some states have decided to use extra state funds to help fund immigrants to receive healthcare, but it's not nationwide. And even if it was nationwide, even if it was the federal government, who the fuck cares? People are receiving healthcare, and that's what you're pissed about? All the horrible, shady things that our tax money funds overseas and here domestically? Your beef is with people receiving healthcare? You're mad that immigrants are getting to see their doctors for their medical condition? Imagine being mad at the most fundamental human right of getting treated for their health. Why aren't you putting your ignorant energy into the 40,000 plus people who die every year from firearms, or the billionaires who continue to widen the income and wealth inequality gap? What about the fact that you, right now as a US citizen, are paying more for healthcare and health insurance than people from any other developed nation on earth? Why aren't you calling out the evil, psychopathic mafia that is private health insurance, whose job it is to get between you and your doctor and deny you as much treatment and care as possible so that that insurance company can reach a specific profit motive to help their shareholders, their dividends that they receive? That's gross and fucked up. That is true violence right there. Not people getting to see a doctor when they're sick. If you're mad about a 5-year-old girl who has a medical condition and gets to see her doctor because she's sick, you are mentally disturbed. For real. The left wants people to all have health care. Everyone. It's a human right. And anyway, undocumented immigrants don't even receive health care right now. But personally, in my opinion, I don't mind every single person, regardless of immigration status, from receiving health care. That's life or death. And that's how other countries do it. Everyone gets health care in many other developed nations. The left wants people to get treatment for their health care. The right wants people to suffer with no health care, merely because of their immigration status. Bitch, we are not the same. Don't tell me you're a Christian and then support some fuck shit like that. That's inhumane. Cruel. We are the richest country in the history of this planet. We can afford healthcare for everyone. The boogeyman is not immigrants receiving healthcare, because your tax money goes to much worse things than people getting healthcare. It goes towards genocide. It goes towards bombing children. So it's not the immigrants receiving treatment for their health condition that is the boogeyman. The real boogeyman is the billionaires and corporations who are weaponizing capitalism to fuck you. That's why we need Medicare for all, or any type of single-payer healthcare system will do. Anyway, back to the Republican government shutdown thing. It's projected that millions of people will have food insecurity because of pausing SNAP benefits. This will cause mass hunger. I have a client right now that I actually just talked to today. They are overwhelmed with life. He had a stroke earlier this year. He has work restrictions. He can only work part-time. And last month, his disability benefits got cut off because of Elon and Doge's social security purge earlier in the year. And now his food stamps are at risk for being paused. This man might not be able to get through November. Thankfully, I'm there and other supports are there to help him get through. That's why I went to school and got my degree in social work, because of stuff like this. But my heart breaks knowing that there are more people than just him that are going to experience that. Potentially millions of Americans who are low income, disabled, unable to work full time because of whatever reason, who are having problems with Medicaid or Medicare because of the cuts earlier this year, are now on the verge of having their food cut off from them for a month. Why is the Republican Party to blame? Well, like I said, they currently hold the House, the Senate, the presidency. They have near full control of the federal government. 2 longest government shutdowns in American history happened under Donald Trump, first in his first term, and now this one is the second longest. This is on Republicans because the Democrats, their hands are being forced to vote no on this. You can't, in good conscience, vote for a budget that is going to strip millions of Americans of their health care, and for millions of others, is going to extremely spike their premium costs. Anyone should vote no on a budget that has that included. The Republicans were told long ago to include provisions for extending the ACA tax credits. They were told long ago, when the budget was getting crafted, that cutting any amount of healthcare was unacceptable. And they went through with it. This is on them. This is on the Republican Party.